Well, a new year and a new subvariant is driving up COVID cases.
The World Health Organization is calling XBB.1.5 that we've been talking so much about the most transmissible one yet, and right now the most dominant strain in the U.S.
Experts say it's the #1 thing people can do is get the latest booster shot. UW Health's Chief Quality Officer, Dr. Jeff Pothof, is here with his weekly visit.
Hi, Dr. Pothof.
Hey, good to see you guys.
I hate to beat this drum every week, but get the booster.
Yeah, we haven't really varied on that point for a good number of months now.
And it seems to be, at least, helps with serious illness.
Yeah, I think, when we initially had our COVID vaccines, they were almost too good because they really almost prevented any disease at all. And there's some vaccines that do that, but many vaccines don't necessarily prevent disease entirely, but they reduce the severity. And that's really where we're at with COVID vaccines. It's where we're at with flu vaccines. You may get some symptoms, but you're likely not to see me in the emergency department. You're not going to end up in the hospital. That's where the real value of these vaccines are.
The CDC said recently that about 90% of us have COVID antibodies now, that we've either had COVID or been exposed to COVID. Could that make any potential new variant less severe?
Yeah, as long as those variants are, similar enough to what we've already been exposed with. I think we saw this when we had the Omicron surge last January. We had all been exposed to Delta and those variants. And then Omicron was enough different where it caused a pretty big spike. Even, XBB.1.5 is close enough to the Omicron variants that, some people might get some symptoms, but to see a large spike like we saw either early in the pandemic or even last January, less likely at this point with so many people with some level of immunity.
Are people COVID out? Are they tired of this?
I'm sure. I almost feel COVID out, but it just won't go away. So I think it's important to kind of keep an eye on what's going on. The real easy answer is figure out what you need to do as far as vaccination or boosters. And if you can keep on that schedule, you've done what you can do to keep yourself as safe as you can. And maybe you don't have to worry so much about what's going on right now.
But in bigger cities, they're bringing back the mask debate. And they're requiring masks in some indoor locations. International travel is considering bringing masking back. So it's still with us.
It's still with us, and really these measures are to slow that spread. What you're trying to do is not have everyone get sick at one time, and by bringing back the masks, especially in places where folks are so packed together, big cities like New York, Times Square can have so many people there, that does reduce the transmission. And if we are seeing some increases in cases, whether it's COVID, flu, or RSV after the holidays, it is starting to show up in those larger places where more people were likely close together for the holidays, and we start to see those cases go up.
It seems as if the flu has sort of peaked around here.
Yeah, I hope we didn't jinx ourselves, but it looks like it went up and it came down a little bit. In some years, it'll continue to just go down and kind of putter out. And some years, we'll see this biphasic influenza where it'll come down and then it'll say, just kidding, and go back up. So we just want to make sure we don't see that second peak. But so far, flu seems to be coming down, which is great to see.
If you get the flu, how long are you contagious?
Yeah, so usually what we say is you want your symptoms to be gone, so particularly the fevers, and then you want to have, at least some of that real kind of vigorous coughing gone. A lot of people have a little bit of a cough afterwards for a week or two, and typically you're for the most part recovered at that point. 5 to 7 days or so would probably be about the right timeline.
Okay. Similar to COVID.
Yeah, for as much as flu and COVID are different, there are a number of things that overlap.
Can you still get a flu shot, or is it getting late now?
Yeah, I would say for sure get it, especially if you haven't gotten flu yet. There's still, even though flu numbers are down, it's still really high. So if you haven't gotten a flu shot, not a bad idea to get one. That way, if you are exposed to influenza, you might not get flu, or if you do get it, it'll be more mild.
Yeah, with this weather, we're kind of confused about what time of year it is. We got a lot of indoor time left.
We do, and who knows what the weather's going to do.
Right.
Warm this week, might be cold next week. I do think for the most part, folks will typically be inside gathering, although no hate in the weather currently. It's been nice.
Get the shot.
Yeah.
Doctor, good to see you again. See you next week.
Good to see you.
Same. See you guys.